this next trend we're going to talk about, it's actually something a little bit more lighthearted because vampires, we all know it's the latest craze. But there's this new controversial trend in the dental community. People are having permanent fangs attached to their teeth. And you may remember this, but Madison, who was a contestant on this season of The Bachelor, she stood out because she wore fangs on the show. She joins us by phone. So Madison, I have to ask you, were those fangs permanent?
No, those things are not permanent. They look just like teeth. They act just like teeth, but they are not. They're a cap and they're removable.
How often do you wear them?
You know, it depends on when the full moon comes out or... No, I'm just kidding. I wear them mostly, you know, if I'm going out sometimes and I want to have a little bit of fun. Don't knock it till you try it.
But I do want to, you know...
I didn't really realize that it had caught on as such a trend. But yeah, you know, it is fun. There certainly are people that do it. So yeah, bring it on.
And Madison, we want to thank you for being here. And Madison's clearly, this is a quote-unquote fun trend. But since some people are doing this permanently, we actually invited two dentists to join us today, Dr. Bill Dorfman and Dr. Clint Herzog. Welcome to you both. And we have both of you here because you have different perspectives on this. So Madison there, these are removable, but Dr. Herzog, you're actually doing some more permanent procedures if people are coming to you asking for fangs and granting them their wish.
You know, with the Twilight craze, people coming in and asking for fangs and they want something different from what Madison had. I put composite veneers. I mean, basically, if you've had braces before, you've had this done before. It's the composite, we bond it, we mold it just like it needs to be, and they walk out with fangs.
And it's totally reversible?
You can take them off. I mean, they're permanent in the fact, just like any other composite is when you put it on there, but you can take it off.
You brought a picture of one of your patients who's had this done? Because again, it's slightly different because it's more permanent than what we were talking about with Madison. Bill, you're here because you disagree with Clint, and why?
Well, I mean, I'm a cosmetic dentist. When people come to me for cosmetic dentistry, I feel like I want to make them look better. I don't mind doing this as a prosthetic. You know, we have a little appliance here. This is removable. You can go to a party. You can wear this for movies. I mean, I've done these for people on Twilight and all that. I don't have a problem with that. You know, but to alter nature in a way that doesn't look natural, I just have an issue with that. I mean, in addition to the damage that you're doing to the tooth, there's also problems. You bite your lip, you know, kiss somebody with fangs, you bite them. You know, I mean, if you want to suck blood, I think it's great.
Isn't it really, though, that we're really saying what's cosmetic? Because he's saying, hey, if it's not natural, it's not cosmetic. Well, I'm not in the position that I'm going to tell my patient what's cosmetic. You know, if they want something that's cosmetic to them, you know, I'm not going to be the moral judge of what's cosmetic.
And here's the most important question. You may disagree because clearly you two disagree on what you believe is a cosmetic improvement. But is there harm? Is there a change in the way they chew or bite?
Is there harm in any cosmetic procedure? Certainly there's risk, but on the spectrum of fangs versus what we do every day, which is cosmetic veneers, where you actually do grind the tooth down permanently and it's not coming back, I mean, it's a no-brainer.
You're saying it's reversible, so you're not doing any permanent damage?
Right, and the risk he's talking about when it's not done correctly. So I want my patients to come to see me or some other qualified dentist and do it right, so we don't have those complications.
Can I ask one question? Will we all agree that people who are having the permanent work done, because I understand some people are trying to grind that tooth down to look permanently like a fang. Would we agree with that?
I think we both agree that's not a great idea.
Absolutely, absolutely.
You know, the biggest problem with bonding is that as you move your jaw in natural excursions, you're going to knock that bonding off. That's the biggest risk, in addition to biting your lips or biting your boyfriend or girlfriend's lips.
Well, I don't understand it. I don't claim to understand why anyone would want fangs. And I understand both of your perspectives. It's personal choice. But I think in the end, the most important thing is that you're not doing something to harm your oral health. Thank you both for weighing in with your opinions. I appreciate it. Coming up.